the Philippines, amidst our vibrant culture and resilient spirit, there lies a story that needs to be told. A story of hope, struggle, and the relentless pursuit of sexual and reproductive health and rights, or SRHR.
So sexual and reproductive health and rights. Those are really big concepts that I have come to learn from the women themselves, talking about our bodies.
The Sexual Health and Empowerment Project, or SHE, is a 7-year initiative from 2018 to 2025, funded by Global Affairs Canada, in partnership with Oxfam Canada, Oxfam Pilipinas, JPIGO, 10 local women's rights organizations, and civil society organizations across 21 municipalities in the Philippines.
Women are taking care of everybody in the family except for their own and except for their own bodies. What is sexual is also gendered. Do we have right to our bodies? Do we have right to sex? Do we have freedom to say no? So this is all part of what we consider sexual. Combining sexual and reproductive with the health and rights, that's where we come in, and that's where we discuss about choices.
The SHE project aimed to empower women and girls in 6 disadvantaged and conflict-affected regions of the Philippines, namely Bicol, Eastern Visayas, Zamboanga Peninsula, Northern Mindanao, Caraga, and the Bangsamoro Autonomous Region in Muslim Mindanao. Despite advancements in modern times, many women and girls are still unaware of their rights and lack access to SRHR information and services. This led to devastating consequences, including increased rates of teenage pregnancy and gender-based violence, or GBV. Many women and girls are unaware of where to seek help, assistance, and information regarding SRHR and GBV services. Understanding their rights and accessing these resources is crucial for their well-being, enabling them to thrive and fully participate and benefit from development. At the core of the SHE project are 2 interconnected pillars. The first pillar focuses on engaging rights holders and community members. Through the dedicated efforts of local partners, we've established safe spaces for conversations about SRHR, thus creating an even increasing demand for SRHR information and services.
Kung wala ning abot ang SHE sa among barangay, siguro walay kabaguhan ang among mga katawhan, labi na sa mga pamilya, bana ug asawa diri sa barangay. Dako kayo akong pasalamat sa SHE nga sulod diri sa among barangay. Kay kung ang pamilya nga naa sa barangay watak-watak, walay pagkahiusa, ang barangay po dili makahatag og harmony sa iyahang mga sakop. So ang kada pamilya gyud nga naabtan sa advokasya sa SHE, nahatagan jud sila og dako kaayo nga kabag-uhan, disiplina, kontrol sa kaugalingon og karon peace of mind sa kada pamilya, peaceful nga kinabuhi. Nga bisan og unsa ka pobre, naa gyud ang pagmamahal.
Engaging men and boys is vital in promoting women's reproductive autonomy. Our approach emphasizes understanding gender and power relations, fostering a culture of respect and shared responsibility.
Bilang tatay, at least magaguide mo na yung mga anak mo sa murang edad pa lang kung ano yung mga karapatan nila at yung mga hindi dapat gawin. Ano? Pangarap ko na lahat ng bahay o household dito is alam na nila kung ano yung karapatan nila as babae. At alam na din ng isang padre de pamilya kung ano yung mga batas ng advokasya. Hanggat nandito po tayo sa magiging advocate, kasi yung pagiging advocate naman namin hindi lang naman sa isang barangay. Kahit ang kagandahan kasi pag maging advocate na katulad ko at katulad ng mga nagiging kasama ko, kahit saang lugar, advocate na ako.
The results are profound. As of March 2024, 6 years since the start of the SHE project, we have engaged nearly 87,000 individuals. 64 information, education, communication materials, including radio spots, print materials like pamphlet, modules, and social media content focused on SRHR promotion and GBV prevention have been co-created with partners and distributed to high-traffic areas to effectively share accurate information and promote positive attitudes. There has also been a significant reduction in the unmet need for family planning among women of reproductive age. In project sites, the percentage of married women not using contraception and not wanting children decreased from 32.2% to 22%, while the rate for girls dropped from 13.3% to 4% in 2024. More women and girls wishing to avoid pregnancy are now using contraception and accessing family planning resources, driven by the outreach and awareness initiatives of the project. In 2023, the teenage pregnancy rate across all project sites dropped to 18.51, with a reduction of 5.92 from 24.43 in 2022. Communities now hold a positive attitude towards the promotion of SRHR and prevention of GBV, mainly recognizing women's reproductive, economic, and sexual autonomy. There has been a significant increase in family planning acceptors across project areas. Since the project began in 2019, around 25,000 individuals have reported using family planning commodities for contraception. It is also reported that in 2023, nearly 66,000 women and girls accessed quality, gender-responsive reproductive health services from rural health units, barangay health centers, and adolescent youth facilities. Community awareness of available SRHR services, including access to contraceptive commodities, has significantly increased over the years. In 2019, only 39% of the targeted population was aware of where to access these services, but by 2024, the figure rose to 88%. The percentage of women empowered to make reproductive health choices independently or with the support from their partners has increased to 68.5% in 2024 from only 46.45% in 2019, enabling them to take control of their health and future. The community's perception of reproductive autonomy grew to 72% as compared to 61% in 2019. This reflects the community's transformed perception of women's autonomy to access information and services about SRHR and decide whether and when to use contraception and when to have children. Shifts in perspectives among duty bearers, including provincial and municipal local government units, barangays, and sangguniang kabataan councils, have led to significant changes in mindsets, policies, and resource allocation for SRHR and GBV prevention. This transformation includes budget allocations for establishing or enhancing services at adolescent youth-friendly facilities, supporting community-led GBV watch groups, and adapting or localizing national laws such as RA 9262 or the Anti-Violence Against Women and Their Children Act of 2004, RA 11313 or Safe Spaces Act of 2019, RA 11596 or the Prohibition of Child Marriage, and the Adolescent Health and Development Program. 446 health service providers have been trained and supported to deliver gender-responsive, age-appropriate, and youth-friendly SRHR services, empowering them to make a positive impact in their communities. 19 out of 20 rural health units across the 6 regions have successfully achieved the standard for delivering gender-responsive SRHR services. These numbers reflect not just statistics, but lives that have been transformed.
Dinhi sa amo ang barangay Del Monte. Ako karon usa ko ka barangay official sa among barangay. Sa una sa wala pa gyud ko nakasunod sa pikiki, ako manggiulawon jud kay Usahay man gud maka-encounter man tag tawo nga unsa man na inyong buan kanang mura mag-ibuli bitaw mi nga mura na mig nangabuang nga magsuroy-suroy bitaw nga kuan, pero usa nakadungog na sila. Nagpasalamat gud sila nga bisan mas maayo gyud nga kamo ning mianhi mo, misulod mo sa amoang purok nga dako gyud kaayong pasalamat sila sa amoa sa SHE.
The second pillar of SHE focuses on building the capacity of women's rights organizations and civil society organizations, ensuring they can effectively advocate for SRHR promotion and GBV prevention. All 10 implementing partners who received institutional strengthening funds confidently shared that it indeed strengthened their capacities to deliver effective SRHR promotion and GBV prevention programs. With grants for their action plans, they have made significant progress in their internal systems, approaches, and activities. 28 research studies and knowledge products have been produced and disseminated to influence policy and programming on women's and girls' rights. 75 national and local campaigns have been implemented to advocate for women's rights and influence policymakers on SRHR and GBV prevention. Through capacity building initiatives and collaborative efforts, WROs have enhanced their effectiveness in engaging with national and local stakeholders, influencing policy formulation and legislative processes. Their roles in developing the implementing rules and regulations for laws like the Prohibition of Child Marriage Law and the Adolescent Pregnancy Prevention Bill has been vital in ensuring these policies incorporate diverse perspectives and are comprehensive and inclusive, specifically addressing the gendered needs of marginalized groups, including women and girls. Another support for WROs and CSOs provided by the SHE project is the Responsive Fund. The fund was used to address emerging needs on SRHR and GBV. For instance, Sentro ng Alternatibong Linggap Panligal has developed an enhanced anti-GBV referral system in Mobile Masbate. This initiative includes the establishment of a community-based advocacy and monitoring group. As a result of this effort, a new policy has been passed which aims to empower communities and create a more effective support network for survivors of gender-based violence. Another example is the consultative crafting of the IRR of the Prohibition of Child Marriage Law with various sectors in the Philippines. The Responsive Fund was also utilized to respond to disasters from 2022 to 2023 in Clarin, Misamis Occidental, and South UP, Maguindanao del Sur. SHE partners PKKK and Unifil Women distributed dignity kits to project area communities to provide their SRHR commodity needs. The dignity kits include, but not limited to, sanitary napkins, hygiene kits, undergarment, malong, and a pamphlet for GBV helplines. With strengthened capacities, knowledge products, and influencing initiatives, these organizations are now more confident in delivering and influencing policies and programs.
Pasalamat ko sa SHE kay sa trainings na avail nako tanan, sila ang naghatag sa moag knowledge ug giya ug unsa ang among pagahimuon.
Women's empowerment is about recognizing and claiming rights, particularly in the realm of sexual and reproductive health choices. When women assert their autonomy, they thrive and transform their lives and inspire positive change within their communities. In Zamboanga Peninsula, the project has helped in normalizing contraceptive use and encouraged open and progressive conversations on SRHR. Women report better communication with their male partners, resulting in more intentional and joint family planning decisions. This shift is also evident in various project communities like Eastern Visayas and Bicol, where the adoption of long-acting reversible contraceptive is rising, reflecting greater confidence and commitment to sustainable and affordable family planning. In Ganasi, Lanao del Sur, more Muslim women now feel comfortable visiting clinics and requesting contraception, marking a significant shift from the previous stigma associated with it.
As I experience sa school, mo na nagkuhan ko kay grabe ka relevant ba yung issue ng teenage pregnancy Mula dito ko na kay isa man po sa purpose sa SHE project is the purpose na mo as peer educators nga do dili lang masolbad na problema, at least malesen o sa makatabang mi sa school, sa community as a peer educators. I hope pinaagi sa mga activities namon ang gipang-conduct o sa pinaagi sa padayon na pagsuporta sa paglambo sa SHE project, dagan pa yung mga batan-on nga knowledgeable sa amo ang mga pang-spread ng mga awareness, sa amo ang mga realizations nga gipanghatag sa ila unta na mahimo ning eye-opener sa ila nga para dili na sila ignorante sa mga mahitabo o sa mga butang nga kakadaot sa ila or mabutang sila sa dili maayo.
Together, we are dismantling the stigma surrounding SRHR and GBV. We are creating a culture of understanding and respect, where every girl and woman can confidently exercise their rights. Let us work together to ensure that SRHR is not just understood, but celebrated and respected. Together, we take action and make bold steps towards creating a society where the SRHR of every individual is upheld and realized. The SHE Project is more than just an initiative. It is a movement toward a gender-equal, healthier, more inclusive, and just future for all.